Hi dear students, in this special series on subject-wise strategy, we are going to identify all the important topics that you must keep in mind before you start working on a subject. We'll be looking at the trend for each subject and then mapping it to all the tasks in the app so that you can prepare better and score better. In this video, we will look at the strategy for preparing general pharmacology. Now, general pharmac is a very interesting subject, of course, but it can get a little challenging because of the number of factual questions that can come from this topic. Moreover, applied pharmacology is nothing but medicine, so there's a lot of overlap with medicine, oral medicine and pharmac. Also, oral surgery, especially in terms of emergencies and local anesthesia, has a lot of overlap with pharmac. So, when you're preparing for pharmac, make sure that you are also looking at these topics from parallel subjects and giving it the attention that it requires. But on the whole, the weightage for pharmac has been pretty consistent over the past few years. In fact, there have been more questions than expected for a couple of years too. But like I said, that you can also consider the same questions would fit in medicine. Now, in this particular video, the way that we are going to approach pharmac strategy is by looking at previous year questions and then allocating them to specific topics on the left side. Now, if you look at these topics, these are divided topics. They are not a bigger umbrella word, but they are broken down into smaller chapters and topics so that we have a better insight on which drugs are more important, and then we can plan our strategy accordingly. So we will go through all the questions on the right and keep assigning them to the topics on the left, and whichever topics have the maximum number of questions should be your primary focus areas, and the ones with lesser number of questions should also be your focus, but you can play around and see how much is your stronger suit, and you can prepare them better if you are not very well versed with them. So this whole video will give you a fair idea as to what you should prepare. Now let's look at questions from previous NEET. So drug of choice for absence seizures, that's CNS. Drug of choice for ventricular tachycardia, adenosine, cardiovascular. Myasthenia gravis is an autoimmune disease of the NMJ caused by antibodies that attack nicotinic receptors, so that's ANS. Penicillamine is an antidote for copper. A patient in the last stages of cancer chemotherapy presented with acute renal failure. Which of the following drugs would have helped him prevent this situation? And the answer is amifostine. So that's chemotherapy for anti-cancer. The only diuretic which exhibits ototoxicity is furosemide. Least anti-inflammatory among the following is paracetamol. It's more antipyretic. Which of the following H1 antihistamines have more antihistaminic than and least anticholinergic property? So that's antihistamines. Which of the following drugs are used to dilate cerebral vessels? Nimodipine. Cardiovascular. Which drug inhibits enzyme aromatase? Endocrine. Valacyclovir is contraindicated in ages greater than 70 antiviral drugs. A cancer patient on long-term chemotherapy has myelosuppression which is characterized by leukopenia, that's anti-cancer drug side effects. Which of the following drug is associated with pseudomembranous colitis? Clindamycin. Drug which acts on NMDA receptors is ketamine. Which of the following drugs belong to selective serotonin reuptake inhibitor? Citalopram, CNS. Patient with chief complaint of diarrhea for 15 days and negative history for long travel should show trophocytes under the microscope. So we have to give antiparasitic metronidazole. Propranolol, widely used in thyroid storm, decreases the sympathetic activity of thyroid gland and decreases the peripheral conversion. Patient on antitubercular drug takes oral contraceptives. Failure of contraception is a side effect of rifampicin. Of course, you can always look at the explanation here. The explanation will give you details of the question, the options and the key concept. The key concept is more consolidated and precise. You can also go through the video explanation. The video explanation will have a lot of additional knowledge with regards to that question. It will also help you understand how to eliminate options, and you can take down notes from these videos. Which of the following drug is used in H1N1? Oseltamivir. A 25-year-old young woman was diagnosed with pulmonary tuberculosis and is on HRCT. Which of the following drugs could have caused this rifampicin resistant bacilli? So this is resistant TB, antitubercular drugs. Which monoclonal antibody is used in rheumatoid arthritis? Infliximab. Female patient on antipsychotic drugs reported to the psychiatrist with hallucination and suicidal tendencies. Then a lot of lab investigations have been put. This question is on clozapine. So these are drugs acting on CNS. Opioid with an anticholinergic action is pethidine. Healthy volunteers participate in which phase of clinical trial? Phase 1. Which of the following has an astringent potential? Zinc chloride. Important. Patient on metformin therapy shows hypersegmented neutrophils on PBS. This could be because of B12 deficiency. An old female patient wants to get rid of wrinkles. So this is about Botox. Neurotoxin used for non-surgical cosmetic management. Next, a 64-year-old patient was suffering from hypertension since 10 years. He is diagnosed with benign prostatic hypertrophy. He should be prescribed prazosin, drugs on ANS. Patient had acute heart failure and pulmonary edema. DOC is furosemide. A repeat question on ventricular tachycardia with adenosine. Again, a question on clinical trial and the phases. Next, a patient on heparin therapy has to undergo emergency surgery. Which of the following drugs is preferred? Protamine sulfate, which is the antagonist. 5-year-old child accidentally consumed excessive iron supplements. Which of the following can be used for acute iron poisoning? So, antagonist again. Vancomycin resistant MRSA has been diagnosed in renal impaired patient. What should be the drug of choice? Linezolid. So, chemotherapy. Which of the following drug is NASSA? So, that's mirtazapine. Antidepressant, drugs on CNS. 40-year-old lady was taking warfarin for DVT prophylaxis and was given ceftriaxone 8 hours before the dental procedure. Now she is complaining of vaginal bleeding, darkening of urine. What is the cause? There is hypoprothrombinemia. Explanation is quite detailed. Make sure you look at all the drug reactions in the explanation. Watch the videos. Patient wants to undergo extraction and is allergic to penicillin. Which of the following drug should be given? Clindamycin. Role of beta blockers in angina is to decrease the workload of the heart. Which of the following is not used in acute asthmatic attack? Chromoglycate. Falciparum is detected in blood in the first trimester of a pregnant patient. Which of the following drug is used with quinine? So you will use clindamycin. Patient suffering from gout is treated with allopurinol. The patient should not receive which of the following? Probenecid is the answer. Again, phases of clinical trial, very important. Go through all the explanations regarding the phase. The key concept, this table is very important. During lumbar puncture, the last layer to be penetrated by the needle is arachnoid. That's a question on general anesthetics and local anesthetics. Proton pump inhibitor is given before meal, GIT. New anesthesia resident mistakenly injects a parasympathomimetic drug in a male patient. You will see some bradycardia. Which of the following antifungal drug possesses anti-androgenic effects? Ketoconazole. Best choice of adrenaline administration during anaphylaxis is intramuscular. Raloxifene is the drug of choice for osteoporosis in postmenopausal women. A woman had myocardial infarction. Her father had a similar history of event followed by death. The doctor prescribed a statin to her. The mechanism of action of the drug is competitive inhibition of HMG-CoA reductase. So let's put that under enzyme inhibition receptors. All of the following are adverse effects of ACE inhibitors except hypokalemia. So this is CVS. Drugs that can be given parenterally to treat a thalassemia patient. That's on blood. Which among the following antibiotic causes chelation with calcium? Tetracyclines, of course. So that's antibiotics. Drug used for treatment of hemophilia is desmopressin on blood. Dobutamine acts on which of the following receptors? Beta 1 receptors. Which of the following drug is given as a prodrug? Enalapril. The prodrug is enalaprilat. Diffusion hypoxia by nitrous oxide is caused by which of the following mechanism? So this is a question on general anesthetics. Nitrous oxide. Which of the following drugs should not be prescribed in a patient suffering from peptic ulcers? Indomethacin. NSAIDs. Patient with prosthetic cardiac valve taking warfarin regularly is brought to you with epistaxis and warfarin overdose. Immediate management is to give fresh frozen plasma. Drugs acting on blood. Which of the following is an astringent? Repeat question. Zinc chloride. A patient complains of dry mouth and eyes with positive anti-Ro and anti-La. This is Sjogren's syndrome. Which of the following drugs? Cevimeline. It will increase salivation. Patient with history of epilepsy throws a seizure on your dental chair. Immediate treatment is diazepam, CNS. Patient with history of asthma starts wheezing on the chair during procedure. Immediate treatment is salbutamol. Always ask the patient to carry their pump. A farmer sprays pesticide in his farm and a day later he is taken to the hospital complaining of profuse salivation, watery eyes, crepitations, involuntary urination, generalized edema. The drug of choice is atropine, organophosphorus poisoning. Flumazenil is used for reversing the respiratory depression caused by midazolam. Beta thalassemia patient was given 125 packets of packed RBC. Which additional drug should be given? So again, blood. Which new generation Salogog has additional M3 action? Cevimeline. Similar question we saw before with xerostomia and Sjogren's. Benzalkonium chloride belongs to which category of disinfectants? Quaternary ammonium compounds. Iron absorption in intestine is caused by vitamin C. Which drug acts by inhibiting sodium potassium ATPase pump? Answer is digoxin, CVS. Anti-Parkinsonian drug associated with peripheral vasospasm is bromocriptine. Next, Young's formula for a child dose of a drug is calculated on the basis of the chronologic age. This question is also there in pedo. A lady taking warfarin, which drug is contraindicated? Fluconazole. Longest acting sulfonamide is sulfamethoxyrazine. The drug of choice for anaphylaxis is of course adrenaline. Drug given for emergency management of angina in a patient of ischemic heart disease, GTN sublingually. Drug causing dissociative anesthesia is ketamine. Third question on ketamine. Drug of choice for malignant hyperthermia is dantrolene sodium. Which of the following agent is not administered for the management of an acute ischemic asthmatic attack? That's chromoglycolate. Repeat question, different language. Proton pump inhibitor are most effective when given before meal. Repeat question, different language. True about zolpidem. It has low abuse potential. It is an antidepressant for CNS. Which of the following antibiotic is bactericidal in action? Aminoglycosides. Oral hypoglycemic drug which causes vitamin B12 deficiency is metformin, endocrinal drug. All are true regarding nitrous oxide except it has poor analgesic action, that's GA. True regarding selective COX-2 inhibitors compared to non-selective NSAIDs is the equivalent renal toxicity. So NSAIDs. Which of the following is a selective COX-2 inhibitor? Celecoxib. Frontal headache is caused by which of the following? Indomethacin. 4 questions back to back from NSAIDs for 2018 NEET paper. Right? So you have to keep an eye for such things. Long-acting drug due to enterohepatic circulation is piroxicam. Which of the following can be safely given in a kidney patient? Fluconazole can be given. Drug of choice in a patient with renal disorder and vancomycin resistant MRSA, linezolid. Repeat question, different language. Main disadvantage of opioid analgesic is urinary retention and also drug dependence. Noradrenergic and specific serotonergic antidepressants. Repeat question with the same options, mirtazapine. Efficiency of carbamazepine reduces with time due to increased drug metabolism. A 28-year-old female on oral contraceptive was given tetracycline for treatment of chronic periodontitis. After 2 months, she became pregnant. What is the reason of contraceptive failure? This is important because the tetracycline inhibits enterohepatic circulation, causing increased excretion of the oral contraceptive. Next, 25-year-old asthmatic patient on theophylline is given ciprofloxacin by the patient who develops dyspnea and palpitations. What could be the cause? It is because it inhibits the metabolism of theophylline. This is the mechanism of action. So look at the flow chart, look at the key concept, right? So this is antibiotics. Next question. 40-year-old patient was taking warfarin 4 grams for DVT prophylaxis and was given ceftriaxone. This is a repeat question from 2023, right? Drug interactions are important. Orange sweat is seen in rifampicin. Fluconazole resistant candidiasis in HIV positive patient is treated by amphotericin B. The dosage of epinephrine for anaphylaxis is very important question. I am surprised it's asked only once. Which of the following is a vesicoselective drug? So that's tolterodine. Type C category of drug in pregnancy is corticosteroid. Abuse of which of the following drugs is commonly associated with seizures? So that's cocaine. And last question, most common side effect of long-term heavy dose of carbamazepine is aplastic anemia. Very standard question. Now that brings us to the summary of what we have achieved so far. So blood and endocrinal drugs is 15 questions. So blood say 7 and endocrine 7. Then followed by CNS and ANS. So nervous system, the sympathomimetic, parasympathomimetic and likewise. So all of these are most important in pharmac. Followed by antibiotics. So antibiotics we have divided into 4 categories here. That's why they look spread out. But antibiotics are very important in pharmac. Then you have local anesthetics and general anesthetics. A lot of these questions you will also find in oral surgery. Followed by cardiovascular and NSAIDs. So this is a summary of all the different type of topics to focus on in pharmac. And make sure that you are very well versed with all the classifications, because if you know the mechanism of action and classification of the whole family, if you know the family and if you know the classification, you can apply the laws to all of these drugs on a very large scale. So classifications are very important in pharmac. Now how do you prepare for pharmac with regards to your NEET MDS exam? So if you look at the task modules in the guided prep in the app, you will see all these tasks which are exactly same as the topics that we just saw. Now supposingly if you want to prepare one of these topics, say for example, let's say you want to prepare chemotherapy, some antibiotic drugs, okay, or NSAIDs, let's see NSAIDs. So here you have all the drugs that you need to know. Suppose if you want to view the workbook, the notes, the video, everything is here with all the flowcharts, right? So this is how your notes will look. You can always check the other flowcharts and take down notes from this. Now the workbook is going to look exactly like this. It will have blank spaces. It will allow you to practice by writing from the notes. And also you can write your own notes on the side. So if you are looking at a complex question, at a video explanation, at new information, you can make a note of that in your workbook, right? Don't forget to watch the multiple choice question explanatory videos from time to time, because they have a lot of content which is important, and that is from a lot of parallel sources. So once you prepare a topic, the next step is to go to practice questions, where you will have a lot of questions in the same topic to prepare. And then you move to take test. Now when you take a test, you will be able to review your answers, look at the explanations, key concepts, and then follow that for all the tasks in the whole subject. So all pharmac, the first step is to clear all the tasks. After you finish your task, move to QBank. QBank is more elaborate, extensive questions. They are categorized in more broader topics. So there is a more hands-on experience with regards to intermingling of topics together. And then you must take the weekly checkpoint test, which will enable you to look at your report from the personalized AI recommendations. So this whole idea has to be carried on for each subject, and pharmac being so volatile, so difficult to remember, your final stroke towards the end are going to really help you in clearing maximum questions from Pharmac during your exam. And now I will tell you how to maximize your preparation with Meritor's app. Now there are 5 things to keep in mind when you start your preparation for any subject at any given point of time. Number 1 is to start with tasks. Like I said, tasks are the building blocks. They are your foundation and fundamental for any subject. You need to start preparing for the task with the workbook. You must look at the video if you have any doubts regarding the topic, and then practice questions. And then you can take the test. Now, whenever you are taking a test or practicing questions, each question comes with the answer, explanation, and key concept. The explanation will be elaborate. It will tell you everything that you need to know about the topic. It is a good source of taking down notes because a lot of additional questions can be asked from the existing explanations, right? And if you are well versed with the topic, you can just look at the key concept and reinforce the topic in your mind. Additionally, a lot of questions also come with multiple choice question videos, which are explanatory videos. They are going to talk about how to eliminate options, how to strategically focus on the question, and additional knowledge that comes with the topic. So your first aim should be to complete all these tasks for a given subject and then move on to the next thing, that is Q bank. Now Q bank or question bank is a collection of high yield extensive questions. They are clubbed together in topics. They are clubbed together chapter wise, and you will have more hands-on experience on difficult and extensive preparation on these questions. Again, they will come with explanatory videos, explanations, and key concepts. So once your tasks and Q bank for a given subject are complete, you are good to appear for the weekly checkpoint tests. Now the tests are of 2 types in the app. One is the weekly checkpoint test and self-paced test. I'll tell you about the weekly checkpoint test first. So suppose if you are preparing one subject over the week, then at the end of the week you will have a test which is going to focus on that specific subject plus the subjects that were previously prepared, right? So that kind of snowballs the entire revision strategy. You will have a repeated encounter of multiple subjects from time to time. So you do not forget. It's easier to keep these topics in mind when you constantly see them. So the revision is reinforced. Plus you also get personalized AI recommendations, right? So at the end of your test, based on your performance, you will get how many questions you answered, what was the score, how much was the negative marking, where are you lacking, what are your stronger points, and then it will tell you how much time to dedicate for a revision of your weaker subjects. So with this strategy, you will be able to focus on specific areas that are your weaknesses. Now that is an exceptional feature of Meritor's app. And the next set of tests is self-paced test, which you can take at any given point of time. These are subject-wise tests. You can also have cumulative tests, multiple recall questions also incorporated in form of tests. And towards the end of your preparation phase, you will have a lot of volatile, factual, high-yield questions in form of final strokes, which are again specialized tests to be able to remember these topics clearly before the exam. Now, once you come closer towards the end of your preparation, you will have access to this special feature of the app called Marathon. This is activated towards the end of your preparation, where you will have 3,500 plus high yield questions. High yield questions meaning they have the chances to be seen in the exam, because either they are based on recall questions or because they are based on important concepts that are repeatedly seen in the exam. So when you practice these 3,500 plus questions, you will also enter an all India competition where you will get a fair idea as to how your performance is with comparison to your colleagues. It's a great boost of confidence if you take it at the right time. And lastly, we have the all famous national mocks, which is a pan India or all India nationwide simulation of NEET MDS exam. We conduct them towards the end of your preparation in a few months to go. And every weekend you will have access to this special test. You will see a lot of new questions in national mocks which are based on important topics. So do not miss national mocks, because it gives you a good hands-on experience of the exam. It gives you an idea of time management, because this is exactly according to NEET pattern, that is 240 questions and 3 hours with negative marking. So you kind of get a very fair and square idea of your performance, because this is again an all India competitive mock exam, and you will get personalized AI recommendations here as well. Now they are more important for national mocks too, because towards the end when you are revising, you will not know which subject to pick up at what time, and your performance in the national mock will be assessed thoroughly, and you will get your AI recommendations which will tell you which subjects to revise. So make sure that you are making use of all of these features in the app. Now, apart from that, if there is any query that you have while solving your questions, if you have any doubts regarding any topics, you can always contact the faculty on the WhatsApp group. We are always here to help you. And I hope with this in mind, you will be able to channelize all your preparation strategy in the right direction. And I hope we'll be able to help you achieve your dream seat in MDS. Thank you so much and good luck from Team Meritors.